So basically, I don't know if you noticed about me. I didn't have dental care growing up. I am actually from Jamaica.
Are
And
you?
yeah, I
Okay.
didn't have dental care growing up. So we are at the forefront for being able to pick up on, hypertension, perhaps diabetes as well too,
Yeah.
just based on what we're seeing inside their mouth as well.
So, doctor, it is so nice to have you. Say, as I've said to so many people before, it's like, it's great to have patients. It's great to have relationships with organizations like Cigna, but we can't do any of this without you. Like so many patients, but like to actually do this unique setup, it all comes down to you. So first and foremost, I just want to say thank you very much.
You're welcome.
Yeah. So, maybe just, how many years have you been practicing?
Been practicing for 12 years.
12
Yeah,
years.
12
Okay.
years. Yay.
Does it feel like it just goes right by?
It goes right by. The first couple of years, you're still on training wheels, and then
Yeah.
after that, you're soaring, and then you're gliding, and then
Yeah.
you find something else that you're like really, really good at. You just hone in and
Yeah.
just take that to the next level.
Well, I can tell at the dental school and you can learn the clinical skill, but to learn the interpersonal communication, which matters so much to people, is that are you syncing in with them?
Yeah.
That takes real effort. I don't know.
I mean, you hit the nail right on the head. So basically, I don't know if you noticed about me. I didn't have dental care growing up. I am actually from Jamaica.
Are
And
you?
yeah,
Okay.
I didn't have dental care growing up. So this is actually a second career for me. I have a very analytical back. You said technical,
Yeah.
but I really miss hanging out with people. And that's one of my skill sets is really like communing with. So, hearing what I hear on a daily basis, just, oh my gosh, I hate the dentist, but you haven't met me yet. Give me a chance,
Yeah,
right?
yeah.
And just really wanted to bring that personalized touch to the field. And it has served me well. I've been practicing for over 12 years and really just allowing people to feel comfortable and open up so that they can get the care that they need.
Yeah.
Like, oral health is connected to everything else. And if this falls down, everything else could be falling down as well too. And they don't really realize that what happens in your mouth affects the rest of your body. So
Yeah.
just bringing that awareness to our patients is super important to me. So yeah, full
I
circle.
So glad
Full
you said
circle.
that. And you gave a story, patient or a couple patients
Mm-hmm.
with high blood pressure. Maybe I can just ask you a little bit about that. You've noticed some patients coming in
Mm-hmm.
in the last couple of days and
Yeah.
doing the blood pressure check.
Yeah.
New for that.
Yeah, so it was new for them. So just recently, just diagnosed a couple of patients this week with high blood pressure.
Yeah.
So one of the things they asked was, isn't this a dental office? Why are we taking blood pressure? I'm like, yeah, we do take blood pressure. So, just seeing how on the cusp of integration we are with the services that we are offering here. And it really just rings so special to me just because the connection between oral health and the rest of our bodies, it's so intimately connected.
Yeah.
So, to bring it back to them, we diagnosed them with high blood pressure and really just said to them, you got to go get checked out by your PCP. So, we see our patients here twice a year, so 6 months. Sometimes the PCPs, they don't see them until a year later. So we are at the forefront for being able to pick up on, hypertension, perhaps diabetes as well too,
Yeah.
just based on what we're seeing inside their mouth as well.
So a dentist had told me
Yeah.
years ago, I think dentists can see 100 plus different ailments,
Mhm.
just by looking in the oral cavity.
Yep.
Can notice that. So yeah. And if a person, and I know this is statistically accurate in the U.S., a person in the U.S. is twice more likely to see a dentist in a given year than their primary care provider. So if that's the case, then it really can be, especially with technology today, the dentist is the primary care provider
Yes.
in the future. It's like if you can get them into the dentist and they gotta see for the hygienist or the dentist cleaning teeth, whoever's doing it, probably more likely the hygienist.
The hygienist.
Although other countries, it's the dentist that's
I
doing
know,
it.
right?
So it's like in Ireland, it's always the dentist cleaning. It's very infrequent. So, and long story short is if they're going to be in the dental practice anyways, and they've got to have that tactile experience of getting a cleaning done, what else can you do? So the blood pressure is obviously important.
Yep.
Before you get in there, if they're already something on them, the anxiety to them.
Definitely.
So, well, another thing I think what we were talking about is that interpersonal communication and how important it is and how well I think you are. I mean, I just by talking to you and I think this extends far beyond dentistry, but I mean, just giving that relationship and having that connection. Um, is there anything about that is towards a better dental experience on the communication that you think is critical to talk to them about? Or, I mean, is it just about their overall health, or is there anything that you kind of think is like, this is what I want to kind of talk to a patient about?
Yeah. I mean, I think people are people and they just want to be treated like a person.
Yeah.
My number one is treat others the way you want to be treated. So if I'm on the other side of a chair and I'm feeling anxious, I would want someone to just like reassure me that everything is going to be okay. And the way that we do that is by telling the patients the steps for things that are going to happen. Because if you think about it, we work with instruments that can work really fast, or we're given anesthesia, and we just want to just make sure that they're calm. If they're calm, we're calm.
Yeah.
If we're calm, they're calm. Like energy really transfers from one person to the other.
So set the expectation with them.
Definitely.
It's like educating them. Hey, this is what's going to happen. This is the process. And I would imagine it's easier for a clinician just to get to their own head. It's like, hey, this is a routine. I'm doing this 5 days a week. I'm seeing X number of patients per day. So if you don't remind yourself to set those expectations, it's easy to forget.
It's easy to forget.
Just to like get into the like almost a few minutes with a patient that was walking out. And she had illustrated that that she had seen a number of different dentists in her lifetime, and she had never felt like she had made a connection. And I can tell you by talking to her, she's told me, she said, "Hey, I got that connection with you, doctor," and so she was saying, "I hope to see her again."
Oh.
So I just want to pass that along
Thank
to
you.
you, and that the patients appreciate it, and we appreciate it, because honestly, that health engagement that you're giving them is what gets people more.
And I thank you so much for that, those kind words. But we want to empower them, right? So we can't do it for them, but we got to empower them, right? And that's one of the things I really love to share with patients, getting down on their level. It's almost like I'm talking to my kiddos. I have 3 kids, and sometimes you're telling them things and it goes over their head, and you're like, okay, let me just see what they're tracking. If they're tracking, if they're not tracking, okay, I need to shift, not them.
Right.
They have no idea. And it's the same with a patient. I'm using words like distal buccal, and they're like, okay, doc, what was that? Like, okay. So really just coming down to their level. I mean, we went to school for a long time, and yes, it's great. And like you said, we can easily get into that techno mumbo jumbo, but really like what they want to know is, do you understand what's going on? Can you relate it to me in a way that I can understand it, so I can know what to do with that information, right?
Yeah, and you are giving that, you're empowering them as educating them and making them say is you're empowering them with the education, so that's great. But it's also giving them accountability.
Yes.
They have to have, I think that's really key. I was mentioning this on an earlier podcast, is that one of my favorite books, and I'll butcher his name, but it's Dr. Peter Attia, and he wrote a book recently called Outlive. And maybe it was 2 years ago. But he was to Stanford for his medical degree, and he was practicing, I don't know, for some short amount of time, and he kind of switched over to the data analytics. And so this book that he wrote, Outlive, which is pretty popular, it talks about this, is about getting medicine 3.0, which is getting people more in control of their health at an earlier ages, so that they could have a healthier, long life, not a degraded health at 60 plus. But, when you're supposed to be, enjoying your life, relaxing, tired, you want to be able to, like, the simple thing is, I mean, from the dental perspective, if you're going to be retired and you want to travel to Italy, you don't want to be, if you got all your teeth, you can have the full menu.
Yes.
If you don't have all your full teeth, you might be limited on what you can eat to enjoy it. So, I mean, I don't know, that oral to overall health, it's not just about finding other kind of issues of the overall body in the from the dental experience, but it's really about, educating them and making them as healthy as they can be for
a long time. And it's funny when you just mentioned that, the word that just popped in my head was health is like longevity.
Yeah.
Right? Like when you think about it, like you're not just, and I was explaining to a patient today, yeah, I may tell you these are the options, but we want to think long term, right? If you have a more long term overview on things, like decisions that you make, if you have that as the perspective, sometimes it changes the decisions that you make in the now moment, right? Because you're looking, okay, well, I want to be able to eat well. I want to be able to enjoy the sun. I want to be able to, spend time with my family. The decisions that I make now, they have to count for the future.
Honestly, I mean, I'm the worst patient. Okay, like I mean, for everything. I saw something this morning on LinkedIn. It was like the average person takes 70 days after they have had some symptom of an issue. So it takes them 70 days before they'll go and talk to a provider.
Oh,
From the time that I noticed I have this ache or whatever it is. That's how long. And I thought about this, and I'm embarrassed to say this, but like, I'm the same way. Like, I can't think of something that I was like, oh, I'll take care of it. And maybe it's my age group, 50-some-year-old man. But I'm wondering, do you see this as better with the younger demographic, like the younger 20-somethings? Are they more paying attention? Do they heed the advice that you're giving them better?
Oh yeah, for sure. For sure. I think, I don't know, is this talking, our team right now, we have a lot of Gen Zs. And, their mentality is just, it's fresh.
Yeah.
It's like, they have a different perspective, like more like the health is my long-term outlook, right? So there are things that they're just not going to tolerate. And I say that very kindly. They're just not going to tolerate it. And one of those things is, sacrifice to their mental well-being, sacrifice to their health, physical health. Like they just have these new standards that I took time to build up because maybe, I don't know, maybe I wasn't, but their mentality is completely different from my own. And I really appreciate that because now when I talk to them, they're actually, well, doc, I've been flossing, I've been brushing, I've been doing all these things. Okay, great. And you can see the difference, right? They're not having as many cavities. They're not eating as much sugar as, other generations are doing. And you can see the difference. Like, I know, right?
I feel like that's like, that's the way to just get it out.
So, I mean, I think they're more amenable to, suggestions and improvement as to how to preserve their health for the long haul than older generations have been. And it's okay. It's just going to take some time, different hammer, right? Different kind of hammer for the same information. But there are some generational differences, and just being able to tap into that also gives you, like, how can I present this information in a way that it's going to be well received? Right? Just by age group.
Well, and you got to know it. I mean, you got to be ready for it. Obviously, it's like, no, but it's good to hear. I guess it's generally good to hear that they're paying more attention to it, and taking your advice. So, okay. Well, I wanted to get a couple extra minutes of your time. I know you probably got patients waiting, and you got to have your lunch and all that. So, thank you so much for your time. And
you're welcome.
And thanks. I know Access Care very much looks forward to working with you in my capacity.
As do I. Thank you so much for having me here.
Fantastic. All right. That's a wrap.